Good morning, and thank you so much for joining us for Seniors Blue Book University. I am your moderator this morning and the publisher of Seniors Blue Book, Amanda Barton. Very delighted today to bring on several of my beloved partners. We're going to start off by introducing each of you guys and giving you an opportunity to tell us a little bit about yourself and the organization that you're here to represent. We'll start with Yvonne Lissetti, who is with Holistic and Home Therapy. Good morning, Yvonne.
Good morning. Thank you for having me.
Right.
I'm a physical therapist assistant and a brain health personal trainer, also a laser specialist. And I have recently realized I am really more of a life coach through this last year. So I do provide a very Western Eastern approach to my therapies and services that I serve with my seniors in the different communities. And because a lot of our seniors have been in lockdown, I have been blessed and fortunate enough to be able to go in, being COVID tested and vaccinated, to be there for them and provide a holistic whole body approach, mind, body, and spirit. So that's a little bit about my holistic services that I offer.
Perfect.
Thank you.
Thank you, Yvonne. All right. And next, we're going to be introducing Dr. Vivian Ebert, who is with Living Well Chiropractic. Good morning, Vivian. How are you?
Hi. Good morning. I'm a chiropractor here in town for over 30 years, and the office, with chiropractic, we've always been a holistic profession. And always looking at the patient as a whole. And I've just really enjoyed being up in the Bonita Estero area the last 10 years, and really an active group of people. And I really feel that's one of our goals, is that keeping people mobile, keep them active, keeping up their lifestyle. And and I do have a certification with sports injuries, so I really do enjoy working with the golfers, the tennis players, and I would have to say the majority of them are they're not the weekend warriors anymore. They're out there working at it every day.
Yeah, I can say every time I've been in your office, I hear somebody talking about their golf game or their tennis game. So
yeah.
I know
they're active.
You've saved my back a few times, so I appreciate that so much. All right. Up next is Tara DeMond, who is here representing Iona Cannabis Clinic. How are you this morning?
Hi, Amanda. Hi, everybody. Thanks for having me. I am a registered nurse, and I work for Iona Cannabis Clinic at the Bonita Springs location. And a little bit about how we help people is education. We have to do a lot of education just for people to learn that this is medicine and how to use it as medicine. Mm-hmm. Some people come in just misinformed with the stigmas and stuff. So our goal a lot of times is as pain management or people, that want to have healthier alternatives to seizure medications, all different sorts of things. So we see a lot of patients here, and we just, like I said, holistical ways to approach anything from seizures to insomnia.
Right. And headaches and everything in between. Right?
Headaches and everything in between. Like I tell people, you take this medicine for your anxiety, but you're not going to believe it, but your back's going to feel better.
Right. Yep. All right. And last but certainly not least, your name even sounds holistic. We have Ralph Lagdon, who's here with us from Heart, Body, and Mind. How are you this morning?
Well, I'm doing well. Good morning to everyone. And Amanda, thank you again for inviting me to the panel. So Heart, Body, and Mind Home Care, we do senior home care services in the 3 southwestern Florida counties, Naples, Fort Myers, and Port Charlotte. But we do come from a holistic point of view, and we can talk about that. I know we're going to talk about that a little bit later. But other than that, I'm glad to be here and share what we do.
Perfect. Thank you so much. So we're going to dive right into the I would say Q&A. We want to hear from everybody out there who's watching this. So if you can just put your questions in the chat, we would love to answer them for you. So I want to start over with Yvonne. You have a very holistic approach. Tell me the use of mindfulness skills and the law of attraction when it comes to health and wellness.
Okay, mindfulness simply means we use awareness and intention of our thoughts and our actions. So we can use mindfulness skills to break bad habits, to provide positive results, simply by being more mindful. And the way we think and the way we act truly matters. We don't want to take that for granted. Everything that we're putting out is a reflection of who we are. And that is the law of attraction. So the law of attraction is scientifically based. And so we need to start being more mindful and conscious of what we're thinking, how we're acting. I had a kind of a annoying thought the other day, and my door hit me in the head. And I'm like, okay. And I really try hard to practice positive thought and actions and being conscientious of what I'm putting out, because when we use positive energy and we put out positive energy, we get positive things back into our lives. And as a healthcare practitioner, I want to make sure that that's what I'm putting out with my clients. And it's really, really important that we are the light for ourselves, our family, and specifically our clients. And it really is making a difference in their lives, especially during this year. So be mindful of the power of attraction, the law of attraction, because it is our reality. Every thought makes a neural connection. So we want to leverage the potential and the power of our thoughts to serve us. So very important, our power of our thoughts, potential of our thoughts to serve us instead of the opposite. We want to start our day. This is a new thing I've been doing. I read this really great book. It's called Abundance on Demand. It's fantastic. It's by Colette Stryker. And she talks about, I hadn't been doing this, I guess I thought I did it, but start each day with gratitude. Before you get out of bed, start each day with gratitude, maybe some positive affirmations, because that is our mindset for the rest of the day. Just a few little minutes makes a big difference to set that mindset. Then throughout the day, you want to have little gratitude tune-ups. So just throw little gratitude thoughts, little positive affirmations for yourself, for others, and it makes a difference. We're contributing instead of taking, which again is really very healthy for all of us. And then in the evening, when our head is on the pillow, we want to, this is really, really important. And there's so much research on the subconscious. So our subconscious is in control basically at least 95% of the time. So we want to be mindful and conscious about making sure that our subconscious is happy and we're feeding our brain with happy thoughts and happy visions. So when we lie down at night and we're ready to go to sleep, make sure you're feeding, especially if you watch scary movies before you go to bed. We want to try to wipe that out. So lying down, you want to, again, finish your day with gratitude thoughts, positive affirmations. You're setting the tone for your subconscious, which is very busy at night. The power of gratitude, the research behind that, people that practice gratitude have stronger immune systems, lower blood pressure, and they experience higher levels of good emotions. So gratitude actually runs on the same frequency as love. And so that's just, we want to make sure that we're conscientious of that. And then feeling good. There's lots of books that, the Blue Zones, Dan Buettner, I think he has a new book on feeling good. We don't want to we want to make sure that we're being mindful of feeling good, especially during this time. Because when we feel good, our brain actually produces those neurotransmitters, the feel-good neurotransmitters, serotonin, dopamine. So just by feeling good and smiling, just the act of smiling helps to produce those neurotransmitters that makes us feel good. So when we feel good and when we're mindful and we're creating those feel-good habits, which we can create in 21 days very easily, they become more automatic. We are more resilient to the world around us and stress. So use gratitude, practice feel-good habits, smile more, and raise your vibrational level for the power of the law of attraction to serve you and serve others.
I don't know if the rest of you feel this way, but I just want to call Yvonne every morning. This is how I want to start my day. I am my gratitude is for all of you for being here today and being a supporter of Seniors Blue Book. So there, I said my gratitude.
So it's simple, just simple little things, and they work. Thank you.
Well, thank you, Yvonne. I appreciate that so much. Okay. Next up, we have Tara DeMond, who is with us from Iona Cannabis Clinic. And I think it's really important to talk about cannabis and how it helps your entire body. You made that comment earlier about how it comes in and helps your back. I love that. So talk to me a little bit about how cannabis can be used as an alternative to opioids or other medications.
Well, that is always the big question, because a lot of people think that, marijuana or cannabis has the addictive personalities such as opioids. Mm-hmm. And it all comes down to our receptors in our body. So everybody's heard of the central nervous system, and it's in our brain. So whenever we take opioids, it works off of the brain. It binds with our opioid receptors. So a lot of times people hear of people that take pain medicine and they overdose, but it isn't that they took the medication to overdose. That wasn't their ending, what they were wanting to happen, but they take it over medicated by their doctors being prescribed, and everybody's different. So if I take something that someone else can take, I can have an overdose just because of the way that it hits my receptor. The central nervous system receptor is in control of a lot of things, such as breathing. Our brain tells our body to do everything. So that's when people a lot of times over-medicate, and they end up not breathing, their heart stops beating. So that's reacting off of the central nervous system. Now we talk about medical cannabis, medical marijuana, and a holistical approach with CBD and THC. We're working on an endocannabinoid system. They don't teach that in nursing school. They don't teach it in medical school. But there is classes out there now being provided at the colleges. And some of the young kids, they have this opportunity to learn this, and we tell them, learn about this. So our endocannabinoid system has receptors, CB1 and CB2, which our brain and our stomach. And a lot of people don't realize is if your brain won't stop and your stomach's upset, they don't realize that those two are connected. So if we can get your let's say your anxiety under control, or panic attacks or anything like that, they'll come in and say, you know what, I was taking this thing for my stomach. I used to take this prescription and I had to take it every day. But now that I'm on medical cannabis, well, that goes back to the CB1 and CB2 receptors that work in our body, and it takes CBD and THC together. Like I'll have patients come in and say, all I want is THC. That's the only thing that works for me because I have a lot of pain. Or I'll have people come in and say, I don't want to try anything but CBD. I don't want to get high. And then I have to explain is there is an approach for every patient. We can educate them on how to take CBD with a little bit of THC. So Parkinson's patients, for instance, that are having tremors, they take a lot of CBD, and some of their doctors don't want them to have THC. So they'll literally put them in the MMUR, the Medical Marijuana Use Registry, for only CBD, or they call it low THC. But other patients that are allowed to have both, you can take, say, so many milligrams of CBD with only 1 milligram of THC. That's just enough to make those receptors open up, talk to each other with a natural product. And then all of a sudden the tremors start to decrease, because, with Parkinson's, we want to treat symptoms. Then on the other end, we got people that for pain management, and like we talked earlier with opiates. So their central nervous system's already being hit with opiates. They've been taking those pharmaceuticals for years and years and years. And then we come in with medical marijuana. Now we're hitting the endocannabinoid system, and we're hitting CB1 and CB2 receptors. So now patients are feeling relief in another way that they've never ever experienced. And a lot of the doctors don't even understand it. So the patients are coming back on, well, this is what I told my doctor you said. And they're like, wow, So people are finding relief. And like I said, you might be coming in because you have really bad anxiety, but along the years you got neck pain that's just, it's just chronic, it's just there and you live with it. And then all of a sudden, a couple months into the program, you're thinking, wow, my mood's really good and my neck pain's gone. Well, tension, and then now you got your not only CBD that's helping with your mood, but it also helps with inflammation. So I always tell them, this is a broad spectrum medication. And when you come back and see me in 7 months, you're going to get to tell me everything that it did for you. So when it comes to opioids and alcohol, have a lot of people that they like their glass of wine or two, but they don't like to have to drink the third or fourth one to go to bed at night. So there is a way that you can take medical marijuana and still enjoy that glass of wine and have a good night's sleep and not wake up and feeling hungover or and depressed. Alcohol and opioids make you depressed. So you wake up in the morning refreshed and
ready to start the day.
and ready to start the day.
Awesome. Well, thank you so much, Tara. I enjoy listening to you debunk the theory of why people should not take marijuana. And that's probably another topic altogether that we can get into at another time. Dr. Ebert, I wanted to ask you, as far as chiropractic care, talk about how it translates to the whole body and what type of conditions do chiropractic doctors such as yourself help with?
Well, it was interesting what Tara, the majority of patients come in because they're in pain, which is usually headaches, neck pain, arm pain, low back, sciatica. They've either hurt themselves or it is a gradual, they've got a chronic problem. Now they're a little overweight or maybe they overdid it. So there's, a multitude of issues that will set it off. But it's interesting where they usually start with one area and all of a sudden it's like, geez, my back pain's gone, but I've really noticed my digestion is better. Or, geez, my sinuses haven't been as bad. They came in for neck pain, but all of a sudden other symptoms because the nervous system, and instead of the central, as she said, ours is more the nervous system where the nerves are coming out into your arms and into your legs, going into the stomach, the chest. That's why sometimes asthmatics do well with chiropractic, because you're always trying to go back to that nerve root where those nerves go to those organs. But I would say the majority of patients come in more with that specific musculoskeletal pain. Mm-hmm. And all of a sudden it's like, oh, I'm improving in this area. So it's really a nice, sometimes you add to it, but a lot of times I don't tell you about the other symptoms because that's not what they came in for. So it is that holistic and that the whole body type of that we're looking at to say, maybe this will help that also. Just like so many patients just don't realize that we can help with headaches.
Mhm.
They're usually coming in with the neck pain. Then they end up, well, that's normal. Oh yeah, I have headaches. That's normal for me. And I'm like, well, that's just not normal. And so, they get so used to a condition, and since nothing really has helped it, then they just start thinking, well, I guess that's normal for me. My mom had headaches. My aunt had headaches. They kind of throw it in with those kind of conditions. But we really do, you really want to look at the patient as a whole. And, sometimes I think they might even think I'm asking too many questions, but you're like, what are your hobbies? What are your sports? Everyone, a lot of them retired. Well, what are you retired from? And it just, because I want to know, were they out there, really working hard? Were they more sitting at a desk? Were they traveling? It just gives you a little more insight into their world, and also what they've been doing for the last 30, 40 years.
Mhm.
So there really is that, that you're looking at the patient as a whole.
Mhm.
And then also trying to figure out, you get to know your patients pretty quickly, because we are kind of hands-on people, and you're seeing them a lot of times, multiple times. So you really get to know their personalities. And so you try to fit, what will they follow through on, and just with the exercise and things like that, what can we, a lot of times I will give them, it's like, this is your homework. And I want you to find out which, gym do you want to go to, or, are you going to get with your girlfriends, or, and I always push this one stretching on TV called Classical Stretch, and it's on public broadcasting, PBS, at 6 a.m., but you record it. It's about as easy as you can get, a 20-minute stretching by someone who's in her 60s, and I think now 70, who changes it every day. And it's just that whole mobility.
Mhm.
And, so you can't change people, everything, but you just kind of keep nipping at what else could we get you to do that's going to help you and that you'll enjoy, or just that you have to accept. You should exercise. And people, just like with their diets and exercise, they'll go around in circles on how else to do it.
Yeah.
But it always comes down to the same thing, eating better and exercising. And just like the mindfulness, you've got to really be mindful of what you're eating, mindful of your posture, your exercise. So many people right now they're all at these makeshift kitchen desk setups, and they just don't realize 8 hours of sitting there, puts a toll on their posture and their spine. So
Makes me want to sit up straight.
right. Yeah. Yeah. All of it. Here I'm at my kitchen, also doing a setup, but, it just, all these things are cumulative. And a lot of times, looking for better posture, but there's always something that you can do to help improve. And I think, I just like to say we're a piece of the pie. We're not the all end, can, correct everything, but you just keep plugging away. I always tell them it's war. Gravity wants to pull you down. We're trying to get you back, but it's not a passive. They've got to do their part also. And I think, again, that's that holistic, that's their mindset. And, I find people are very open, but it's hard to change habits for sure.
It is. And I know you didn't mention this, but another thing that really, I think, makes your practice holistic is your passion for nutrition and education, as well as looking at the whole body. So you've got a ton of experience and a wealth of knowledge to share with everyone. We could probably do a whole SBB Live on yours as well as Medical Cannabis, and we've already done Yvonne. So anybody that wants to see that one, we'll have to send the link out. So let us know if you want to see that. All right, Ralph. Good morning. How are you? Heart, body,
Good morning.
yes.
Good morning to everyone.
The name of your company actually says it all: heart, body, and mind. So talk to me about how home care can be holistic.
Well, sure. And I have to say, I'm so glad to be part of the panel with Yvonne and Tara and Dr. Ebert, because, like each of them, I believe in the power of mindfulness in relation to stress management, controlling anxiety, pain relief. I fully support Yvonne in that endeavor. And chiropractic, I've personally been involved as my buddy's guinea pig when he became a chiropractor in New York City back in 1990. Up until this very day, chiropractic has been very beneficial for myself and my entire family. And I support Tara and her endeavors with CBD and cannabis, another form, an alternative health and wellness, avenue, let's say, vehicle for people who might benefit from that. So thanks to you for inviting me on the panel. So Heart, Body, Mind Home Care, we're based in Fort Myers. We work in Naples, and we have another office up in Port Charlotte. We do come from a holistic approach. Some of that is a holistic philosophy, but it's also a practical way and processes of how you deliver home care to our seniors. As Dr. Ebert said, we focus on the whole person. So we all know in home care, we assist with what we call activities of daily living, bathing, showering, oral hygiene, assistance with dressing, grooming, ambulation, people who might be a fall risk. We focus on medication management, medication reminders. We do all of those things with our home health aides, trained home health aides, certified nurse assistants. One of the factors that is part of our holistic approach is, and the whole person, as Dr. Ebert suggested, is we believe that it's important to also look at the nucleus of people around we call them care recipient, but the client. Who do they live with? Is it a spouse, perhaps adult children, perhaps others? And what is and what should be the involvement of these other family caregivers, let's say, in the care of our client? So to do that, we're very transparent in how we do and what we do, but we also have resources available for family caregivers. So when our professional caregivers leave the home, perhaps ideally, the level of care doesn't drop off significantly. For example, we have a family learning center. It's free to all of our clients and family members. Family Learning Center has 50 how-to videos: dementia care, Alzheimer's. What does Alzheimer's look like in the various stages of Alzheimer's? What are the behaviors you can anticipate? What are the reciprocal responses? Daily care, 50 different videos, and several of them are also in Spanish. We also have 30 downloadable how-to guides, downloadable to the family caregivers, so that if they want to perhaps become better at what they do and how they take care of their loved one, well, that's available through us as well. We have another offering. It's a family room. Again, it's no additional charge. It's just part of our service. The family room connects family members to the family caregiver and through our company. In other words, you can see what the daily tasks are, what the agenda is for the day or for the week. You can leave real-time messages to us, and you can see messages that we post through the caregiver. It has other features too: bill pay, split pay. But the point there is, especially in Florida, there are a lot of out-of-state adult children, quite frankly. We recently had a family where 6 daughters between Connecticut, Chicago, and Texas. All of them used the family room to communicate and see what was going on. So the point there is, we work as a team. we do what we do. We are an agency that employs all of our caregivers. We don't utilize independent contractors. That's really important. That allows us to supervise. Independent contractors are not supervised. We supervise all of our caregivers. We do pre-COVID, we did spot checks weekly, and everybody was on a rotation. During COVID, not so many spot checks for obvious reasons. And then we went to Friday checkup calls. We screen our clients about 10% every Friday. And we'll get through everybody. And then we mitigate any issues, and we also compliment the caregivers who are doing a great job. We're licensed, bonded, insured. We inspect what we expect. So all of that together, we think we have some great practices to provide excellent care delivery. We think that we've received, dozens of accolades from all of our clients. So we are motivated and empowered, and inspired by the feedback that we're getting.
Yeah, no, that's great. Thank you, Ralph. I really appreciate that. Impressed with all of the videos that you have to offer the families. That is one thing that I think makes your company so unique, and definitely on a holistic approach. So I just want to thank you all for coming on. I want to give everyone an opportunity to give a quick closing remark. We'll start up with Yvonne.
Just want to remind everyone to use mindfulness with your thoughts and your actions, and really leverage the power and the potential of your thoughts. Thought itself is one of the most influential ways to affect our brain health. So think rewiring our brain, be very conscious of how we're rewiring our brain with healthy habits, mind, body, and spirit, a whole body approach, and create those habits with feeling good and a smile on your face when you wake up during the day and at night. And the law of attraction is real. So we want to be very mindful of that and contribute to our family and friends and our clients. And we receive all that love and gratitude back into our lives as well.
And remember to smile. All right, Tara, closing remarks.
I think I would like to leave everybody with that, medical cannabis can be used as medicine, that it isn't smoking and inhalations. There is all different methods that can help you with patches even. A lot of people don't know about that. So don't be afraid, ask the questions, try to break the stigma, because there is, I want to say, I think 500,000 patients in the state of Florida now. So it might not be for you, but it could be for your family members, your friends, your neighbor. Yeah. The little old guy that you see every day that has a hard time walking his dog down the street, is talk about it, ask about it. And if anybody has any questions, at Iona Cannabis Clinic, we're all open, very educated. We see a lot of patients. We even educate, like I said, doctors, pain management doctors. So anybody that is out there that feels that they would benefit from talking to us, just have them reach out to us.
Yeah. Education is key. Thank you, Tara.
Yes.
All right, Dr. Ebert, other than posture, sit up straight, any closing remarks?
Well, I think for a lot of people, just to consider chiropractic for their problem. I always have kind of an open door to say, just come in, talk to me, and I'll be able to direct you to say that's something that chiropractic has helped, or if it isn't, it's more like, what, I want you to go talk to this person. You hate to ever tell someone, sorry, this is end of the road for you, or you're not going to be able to get. There's always something out there that can help them. And, it's just one of those things that you want to be able to direct them as much as you can. But chiropractic is very safe. Some of the myths that I hear people say, and I'm like, it's very hard to hurt a patient.
Right.
And we have the lowest malpractice. I'm always like, hey, we're not the ones, it's a non-surgical, non-drug profession. And we really do that. Always have had that holistic, that's just how our colleges are, to look at the patient as a whole. So, and insurances do cover, and most offices have ways to work with patients, but, just consider it as an avenue.
Yeah, absolutely. I couldn't agree more. And remember to sit up straight. All right, Ralph.
All right. Well, I would say if anyone listening might be considering home care services for themselves or their family, call us. Call us. We're in Naples, Fort Myers, Port Charlotte. You can reach us in Fort Myers, Port Charlotte, 239-603-6455. You can reach our Port Charlotte office at 941-347-4421. And all consultations are free. We'll just have a chat.
All right, awesome. And we'll be putting all those numbers in the description. So thank you so much for joining us today for SBB University. And until next time, I appreciate all of you so much.